Our topic today is a standardized and highly effective red clover extract for menopause. I want to talk about our studies, about topics in the background, about theories, about the activity of isoflavones, and in which areas we can effectively use isoflavones for treatment in menopause. The beginning of our studies, of our first introduction into this topic was that we saw that in studies, if you test the urine of women and compare it, for example, between Europe and Malaysia, China and Singapore, so more the Asian compared to the European areas, when you see metabolic substances of isoflavones inside the urine, then you have a lower incidence of menopause complaints. And this was our introduction in the menopause area combined to isoflavones, started about 20 years ago at the University of Vienna on our Gynecological and Endocrinological Institute. The interesting thing is there are subtypes, most of the people meanwhile know, of estrogen receptors. We have alpha and beta receptors. Funny thing is the brain has both, so alpha and beta is inside the brain. Liver, uterus, breast, for example, have the alpha receptor. Very important for us is the mammalian gland, so the breast with alpha receptors. We have to talk about it in the following slides. On the other side, topics we are focused on are skin, blood vessels, bone, and what we don't see on the list, but it's also very important, for example, is skin and hair. The very interesting thing on isoflavones, also called phytosperms, is that they are selective estrogen receptor modulators. What is the main advantage of SERMs? That means selective estrogen receptor modulators, what we have in using isoflavones. What we really love is they bind on both receptors, but they bind in a different way. On the alpha receptor, it's on the right side. They bind, but they don't activate the alpha receptor, so you have no action on the alpha receptor, for example, on the mammalian gland, but it blocks synthetic estrogen or the normal estrogen in the body against action there. And this could be one of the major reasons why we see a low number of breast cancer in Asian areas, for example. On the other side, what we want to have is we have the activity of the isoflavone on the beta receptor. It sits on the beta receptor, it activates the beta receptor, and this is the one part of the action, but the second part is if you activate the beta receptor, you see an upregulation of the beta receptor. The own estrogen circulating in the blood of the menopausal woman is more active. On the other side, you suppress the alpha receptor. That means the risky area, for example, again, mammalian gland, is less active. So we have an activation and an upregulation of beta receptor, and you have a deactivation and downregulation of estrogen alpha receptor. That is what gynecological treatment really wants to have. There's a second effect, and this may describe why we have a stronger action that we would compare with after treatment with isoflavones, because on the one side we saw the activation of the beta receptor, but what also happens is that an elevation of the beta receptor by action of isoflavones suppresses the alpha receptor. So that means the alpha receptor is less expressed on the cells. Again, for example, we're talking about mammalian gland. And that means the estrogen activity on the breast is of course lower. It's decreased, and therefore the risk of, for example, getting a breast cancer or the risk of getting breast cancer on the basis of your circulating endogenous estrogen is lower. This SERM effect could be, as I already told you, one of the major reasons why the mammalian gland cancer in Asian areas is much lower than, for example, in the United States or in Europe. What's very nice on this kind of, why did we decide to do our studies on red clover? But not only on red clover, first of all on the so-called MF11RCE substance, because this red clover is high quality produced, and of course what we have is we have a constant quantity and a ratio of the different isoflavones inside. Red clover has 4 subtypes of isoflavones. It's genistein, diethine, bioquinine A, and formononetine. This, for example, compared to soy, and that was one of the reasons why we didn't decide to do our studies in soy, was that soy has only 2 of the subtypes compared to the red clover. And the other point is that soy has additional substances which could be nice for other kinds of treatments, but it's not nice for treating, for example, in menopause, because we have allergic reactions which we didn't want to have in our menopause patients. In our overall study design, we had most of the time about a similar study design. All of our studies are double-blinded, they're placebo-controlled, they're crossover, and studies, of course, at the end, I had to provide efficiency and safety in using isoflavones, or also using isoflavones in combination with hormone replacement therapies. So that means synthetic estrogen, for example. What were our topics? I will talk about every of them in one special slide. First of all, the standards. The standard is, for example, reduction of hot flushes, night sweats, and so on. The second point we were confronted with in menopause women is depressions, anxiety. Then we have the improvement of sleep and less tiredness. We have the elevation of vaginal dryness, of course. This is, first of all, makes pain, for example, during sexual intercourse, but also improves the libido. Of course, one of the most important things women are complaining about in the time of perimenopause and menopause. And what we learned during the first studies, we saw an improvement of skin and hair, which of course was very important for the perimenopause or menopause women. And one of the reasons why later on we tried to start combinations, first of all pointing on the skin quality. And of course at the end, this is the most important topic, since in very many cases we tried to use a natural substance like an isoflavone from red clover instead of a synthetic estrogen. And if I say instead, of course, we have to see, or we have to focus on one special topic. That means, is it safe? If we take it for a long time, is it a safe substance, and can we go on for months, for years in treating menopause with isoflavone? This was the first study we did, focusing on, first of all, hot flushes with about 110 patients. There were 2 groups. The group A was the group starting with the verum, with isoflavone treatment. They had, as you see, you had an immediately optimization in the hot flushes. They were reduced from about 35 per month down to 15. But what you see, the line below, is that when you also, and this is a typical sign for all these kind of studies in menopause with hormonal treatments, with isoflavones, you also see a placebo effect. For me, it's very important to see a placebo effect because we are sure that if you do any kind of treatment, you will have a reaction. But of course, it should be significantly less intensive than treating with an isoflavone. Then we had a washout time of 3 months, and after 3 months, of course, we started the crossover. That means now the group who got the isoflavones now got the placebo and the other way around. And again, what we see is the effect gets lost in both groups, in placebo, and the treatment effect starts. But again, if you compare the second group, then you see that again we have a placebo effect on the isoflavone, below the isoflavone group, and the other way around. The next study is the second most important part of our patients focusing on menopause was depression and anxiety. Of course, to do a serious study, we had to do a classical score. We used the HAD score. And again, we have very nice typical results. First of all, of course, we see, if you have a look at the left column, that's the baseline. Then you see the middle column, you see the placebo effect. And again, very important, you see about 21% placebo effect. That means already the aim of treating without substance already has an effect. And very nice, of course, on the right side, you see that the lowest column is again the red Clover isoflavones. So we have an action on reduction of depression and anxiety. This also was in a personal talk at the end of the study. Most of the women really focused on this topic. And these two factors, so compared placebo and red Clover, we saw a high significant difference. So we went on. Now we come to the area around menopause. Of course, very often even more important than hot flushes, because this was the part of the menopause you can see in your daily confrontation as a wife, of course as lady, as a woman, and as wife. You really focus, and this was things we had to discuss very often, is first of all skin, then sleep, of course, and libido. Again, we have the same setting. We had placebo control, we had a crossover, and directly you see the difference between placebo treatment and, of course, the verum, so that means the isoflavone. And if you compare it again, in this case, you see highly significant difference between both groups. And of course, things you can objectivize, like scalp hair, they have a very low placebo effect. Other things like libido, which could be a little bit subjective, the placebo effect is a little bit higher, but again, very important for us to see the effect of a red Clover. We see a high significant difference between both groups. As I already stressed at the beginning, talking with women in the menopausal or in the perimenopausal situation very, very often focus skin. This is the way how women introduced in the menopausal problems, or maybe by themselves come, for example, to the doctor and talk about the problems with dry skin. So what we try to do is start treatments in combination. And as we know, we have on the one side the effect on the beta receptor. That means isoflavones binds to the beta receptor. The beta receptor keeps the fluid in the skin, so the fluid quality stays high, but without risk on the mammary gland. So this is a very nice introduction. And to optimize the effect, you have to combine it with something optimizing skin condition, for example, hyaluronic acid. In this case, and it was very important to have a substance which you have a very nice metabolization which enters the bloodstream and enters at the end the skin where you need it. The next point, of course, is if you have to take a treatment, and this kind of treatments, of course, we're always talking about years, sometimes even more than 10 years. We have patients up to 20 years meanwhile, which started in the study 20 years ago and are still on red Clover isoflavones. It's very important to see the safety. You have to stress the topic of safety, so you can introduce it into the treatment and stay on it as long as possible. So there are a few studies done on postmenopausal vaginal and sexual health, and to optimize and to objectivize as a result, what we did is we focused on the karyoprognostic and the quantification index, which means how is local health? How is local health in cell structure of the vagina? And as you see on the right column, it's the blue high one. Again, you have a very small placebo effect, of course, because it's easier to objectivize and change on cells inside the vagina. And of course, due to the activation effect of the beta receptor, what we saw at the beginning, if you treat with isoflavones, beta receptor is upregulated, you will have more action of the estrogen circulating in your blood, and you will have a kind of a safety procedure within the vaginal area. This is compared, or even another way to focus on this topic is to address the low risky superficial cells and the not a little bit more risky parabasal cells. And again, we see low low placebo effect. Of course, again, we have the possibility to objectivize, and we see a quite nice and very high effect on the superficial cells by the red clover concentration MF11RCE. On the other side, of course, what we shouldn't see, and this was a very important part, is we should not see a direct hormonal defect on the endometrium and on the hormones. First of all, of course, estrogen. Why shouldn't we see it? Because then it seems to be as the action of the isoflavone in an estrogenic way is too strong for it alone. But as we saw, what we do is we do not rise up the estrogen. We do not, therefore, you shouldn't have a thicker endometrium. This is very important because this could be a cancer risk in higher age. Endometrium should be the same or even less. And of course, therefore, we have to see if the treatment has no influence in the area. And as you see, very nice results compared again placebo to the isoflavone substance. There's almost no change. First of all, no significant change between these both areas. For example, endometrial thickness is about the same in both groups. Why is it important? First of all, endometrial thickness, because the routine controls at the gynecologist do have the only possibility to check the safety once or twice a year is to check, for example, endometrium, which should be low within the menopause time. At the end, a look to the future. Of course, we're talking about long-time treatments. It's a treatment over, as I already told at the beginning, 5, 10, sometimes 15, some patients even 20 years meanwhile. So of course we have to be very sure, also in details, is there a risk or is there no risk for the woman taking a red clover isoflavone. This is the basic for coming studies and coming publications. And what we did is we had a look at MF7 cells, that means mama gland, glandarian tumor cells. These are standard cells. Lots of groups are making science on these cells. And what we did is we did a treatment with red clover isoflavones, and these are the first results. We see about 22,000 genes, which we analyzed in a DNA array. And now what we can do is we can check for every risk cellular area if there is, for example, possibility to reduce the risk of getting a cancer or to optimize the risk. Looking forward, the first results are not surprising. Of course, the first results show us that the risk goes down. Of course, because what we see in bigger countries, a low risk, for example, combination of isoflavones in foods and a very low risk of prostate cancer on the other side of breast cancer. Of course, stresses what we found already in our genetic analysis. Repair mechanisms against cancer cell growth are regulated up. Proliferative activity is regulated down. This will be publications, and will bring us publications in the next months and years. So I might end my first results on this place. Just the background, we have a scientific institute, it's so-called Karl Landstein Institute, it's governmental financed, and of course this is not the only topic, but this is one of the major topics to have a scientific activity on the basis of red clover isoflavones and their activities directly in menopause, but meanwhile in the area around also. Our experience meanwhile are 22 years, so it's quite a long time. Thank you very much, and now I think we'll go on to questions.
Addition of hyaluronic acid as one of the key ingredients in Menopearl. The reason behind it?
As we already stressed a slide, about 10 slides before, our main introduction of isoflavones in treatment of menopause is the funny thing, it's not hot flushes, it's the quality of skin. So very often just at the gynecologist, when the woman approaches, they first of all talk about this quality of skin. So what we saw is we have two optimization possibilities. The one thing is to bring the skin in a situation to take up substances which optimize smoothness, and keep the fluid inside the skin. And that's why we did a combination, because of course this effect is very important for women, and we know that the compliance goes up if the woman sees a reaction on the skin, and first of all skin of course, and then hair.
Does Menopearl help in reducing bone and cardiovascular risk factor in postmenopausal stage?
We're quite sure to have an effect on cardiovascular risk and of course of bone density, because first of all we see it in the estrogenic activity, we see it on the action on the beta receptor. This was not focused on our personal studies, but there are lots of international studies showing that the bone health, all of them show that bone health is optimized, the bone structure is optimized, and therefore you also have an effect on bone density. The same is on, of course, on the long time risk of isoflavones. Meanwhile, we know people not taking it as a kind of a medical therapy, but more having it inside the food, have a high isoflavone level over 50, 60, 70 years, and the risk is not only low, the risk is gone. The health goes up. And the same information we got from EFSA. They told us that there's no risk on taking isoflavones, and therefore we also see, of course, long-term effects like optimization of bone density we see in treatment and in publications. On the other side, cardiovascular risk is of course one of the main topics, because we know women in menopause have an rising and strong increasing risk of their cardiovascular system. Again, we have lots of studies, high-level studies, aiming with lipid profile, with plaque formation, and we could show and we can show that the risk on cardiovascular disease is decreased.
Is it safe for long-term consumption?
Again, we have to talk about our own studies. We have an ongoing study in long-time consumption. Meanwhile, we are talking about 20 years. The risk is low. We will publish it. It's on the way to publication. But not only we alone, also EFSA again told us, if you have a look on all publications, overall on all topics and all ways to focus on the effect of isoflavones, you don't see a risk on the long-time application, at least if you don't go above 150 milligrams per day. There are also studies with higher dosage, but it's, first of all, it's not sensible to treat higher, and second of all, it would be also without higher risk.
How is MF11RCE superior to other red clover supplements?
Well, first of all, the most important part for us as medical doctors and doing science on high level, we have to have a high quality standardized product. So if we do a treatment on the first lady, it has to be the same substance than if we do a treatment on lady number 4 or lady number 400. And therefore we need a substance with guaranteed quality, and we also need a substance with guaranteed combination of the isoflavones in the quiet ratio. In our tests at the beginning of the substance MF11RCE, we saw that overall, all the time of our study or following studies, we had DN6 studies, we always saw the same quality, and therefore we will stay on this treatment.
Can the patient combine with HRT treatment?
Well, this would be my personal, I love this topic, because of course for an increasing number of hot flushes, which may be not completely treated by an isoflavone, the combination of an isoflavone or an SERM with a synthetic estrogen would be perfect. We only have one problem: you cannot combine it in one treatment. You can put it, to tell it directly, you can put it in one capsule or in one tablet or in one cream. So we have to combine it. What we usually do is we start with an isoflavone. In about 80% of our women it's enough, and in 20% it's not completely enough to solve the problem with hot flushes, and therefore we combine it with an estrogen. And what we saw at the end is, of course, we have the protective effect on the alpha receptor, so the estrogen you get is less risky, and you have the upregulation of the beta receptors, so that means you need less synthetic substance, less synthetic estrogen to have the same effect.
As Menopearl is stated as a herbal supplement in the brochure, will this product affect the hormonal pathway?
Well, it cannot directly affect the hormonal pathway. This is not very serious if it would do it, but what it does, of course, it makes the sensitivity of the body better. It optimizes the possibility of the body of the woman to use the own present estrogen. And that's why we see a much higher effect than we would await usually, because we have on the one side the lower effect by directly activating, for example, the beta receptor, and the other way we have the optimized effect in upregulating the beta receptor, what we need for treating, for example, problems with hair, skin, red flush, hot flushes, and bone density, and so on.
Is the use of Menopearl during breast cancer therapy with tamoxifen an option?
This is not the primary study of our up to now finished publications, but for example, this is one of the questions we saw in our genetic analysis. And we know there are groups in the Asian area which directly treat breast cancer afterwards with an isoflavone. Therefore, we know the risk is low, there's no extra risk by combination, and you have an optimization of the situation of the woman with breast cancer if you combine it.